you guess which anti-aging approach could add over $38 trillion to the global economy in just 1 year without curing a single disease? Hey everyone, welcome to Decoding Longevity, where we break down the science of aging and longevity. I'm Raghav Sehgal, PhD from Yale University, Director of Bioinformatics at Healthy Longevity Clinic, and Principal at Longevity Tech Fund. I've also been Forbes 30 Under 30 in the healthcare category for building a biomarker that quantifies aging in 11 different organs of your body from a single blood draw. And here I'm with my co-host, Macsue. Macsue, why don't you introduce yourself?
Hey everybody, so this is Macsue Jacques. I am a postdoctoral researcher at Monash University in Australia. And as Raghav, I am also a longevity researcher in the aging field, looking at all the different tissues in the body and how that actually leads to different patterns of aging. As we know that not every organ ages the same. So we are both researchers in aging and longevity, as you can see, and we decided to start this podcast to simplify research for the general public and the non-researchers. But we also want to keep the science very, very true, as we know that longevity research is very, very complex, and sometimes even us researchers could do with a little bit more clarity. So with that, we would like to start with why longevity research is actually so critical for our society and how can we potentially save trillions of dollars in the future with this field.
Yeah, no, absolutely. Aging isn't just a personal issue. Of course, all of us age, but it's also a very global economic challenge that we're facing. The whole global population is aging. Do you know, Macsue, around 1 in 10 people right now are above the age of 65. But by the time we turn 60, 1 in 5 people are going to be above the age of 65. It's crazy, right? And by the year 2100, that's going to be 1 in 4 people. So clearly, there's a huge aging problem that the world is going to face, and it's going to cause economic challenge across the globe. So we actually found this really fascinating paper in Nature Aging called The Economic Value of Targeting Aging by Andrew Scott, Martin Ellison, and David Sinclair, the famous David Sinclair, of course. And it really breaks down why tackling aging isn't just good for health. It is actually essential for the global economy.
Yeah, absolutely. Like, as you said, the population is just aging population is just doubling, and we're going to have over 2.1 billion people in the world that are aged by 2050. That's like nearly half of the whole population. So it is very, very pressing. But right now, the approach that we have is really not sustainable. So we're getting better at treating diseases like cancer, heart disease, Alzheimer's, but the truth is like we're playing a losing game because we're targeting one thing at a time. And yeah, it's not really causing a massive difference in the economy.
Yeah, you're absolutely right. We're kind of in this, the current medicine paradigm in a way has been very, I would like to call it reactive, right? It tends to sort of treat the disease after we get the disease, right? We get cancer and then we treat it. We get cardiovascular disease and then we are prescribed the statins. We get a sort of something like diabetes and then we are given metformin. But is there a paradigm where we could potentially invert this, right? Where we can almost be preventative about aging? And so the authors of this paper actually describe aging as a ticking time bomb in this very context. And that's not an exaggeration in any way. We have increased life expectancy over these last few years, and actually quite dramatically, as we know that. But we haven't really slowed the rate of aging, which means what's essentially happened, for example, in the US, people from 2020, from somewhere around 2000 to 2020, have their life expectancy increased by almost 5 years, but there has been no increase in the first occurrence of their chronic disease. So they're still getting their first chronic disease at the same age. What that means is that they're living longer periods of time in chronic disease. So essentially, the difference between the time that they get their first chronic disease and their death, essentially, unfortunately, is getting longer and longer. So they're living more in pain, they're more in suffering. And And that's pretty terrible. They're living in worse health and potentially also an economic burden in some ways. The health costs are increasing.
Yeah,
Something to think
that's
about.
that's yeah, that's really the key point because you know, just a personal experience here. I'm all about prevention and being in this field of aging. I'm constantly thinking, okay, how can I be more proactive about my health? But the truth is that not even like the medical system really supports this prevention sort of like approach because as I said, a personal experience. I went to the doctors this week and I went to ask for a panel of blood tests, and just because I know being a researcher, what I should be tracking, what I should not. And the doctor looked at me and look, why do you want all of this? And I was like, well, I just want to be proactive and I want to be sure that everything is good, so I don't get that chronic disease when I'm supposedly should. And it's just like, well, Medicare doesn't actually cover this because unless you have symptoms, you can't test for it.
Mm,
And I'm like,
yeah,
this is crazy.
it's
This
crazy.
it's
Insane.
completely reverse back to front. It just doesn't work, right?
Yeah.
So what the medical system really thinks is that the biggest health crisis is cancer or heart disease or neurodegenerative disease because the symptoms are already there. But all of these have one common underlying thing, which is aging itself.
Yeah. Yeah.
Yeah, so I think it's a very cool that we found a paper that broke down how can we build this economic, like how they build different economic models and what kind of statistical approaches they use to get to the conclusion what is actually the intervention that could really save trillions of dollars in the future.
Yeah.
So yeah.
Yeah, no, it's really exciting. And what's really great about this paper is that it doesn't just argue that we should focus on aging. It actually quantifies it using an economic model called the value of statistical life, or BSL. And that's really,
Yeah, and
you want to talk more about that?
yeah, yeah, that sounds great. So, for those that haven't heard about VSO, it's basically a method where economists use to estimate the monetary value of changes in mortality risk. So, it's used in everything from public health policies to insurance calculations to figure out how much people and governments are willing to pay for extending life expectancy.
Yeah. And so in this paper, it really combined VSL from other demographic and health data to estimate the economic value of different longevity interventions. And that's really powerful, in my opinion. Don't you think, Maxwell?
Yeah, absolutely. So when you're comparing the different aging scenarios, we can then sort of like quantify, okay, which one is actually going to be the best one, which one is going to give us the best result. And they didn't just base themselves in data that we already currently have, but they also use a method that is called Monte Carlo simulation. And for those that are not biostatisticians or don't really work with statistics, what it means is that it's just a fancy way of saying that they ran thousands of possible scenarios, tweaking different variables to see how changes in aging rates would affect both health outcomes and economic value. So it's really really cool what they've done here, don't you think?
Yeah, I love when sort of scientists use fancy terms for doing very simple things, right? Monte Carlo simulation and all. But at the end of it, they model some sort of three very critical scenarios, right? Which is the status quo, how things are, kind of our reactive model of medicine, which is we keep treating diseases one by one as they arise, right? You get cardiovascular disease, you treat it. You get cancer, you treat it, so on and so forth. The second scenario is we're able to extend lifespan, which is people live longer, but without really slowing their aging rate, right? So you're able to somehow extend their lifespan, but you're not really able to slow their aging rate. So people are potentially living longer with chronic diseases, so on and so forth, right? So they're still developing diseases, still at the same rate, still at a young age. Well, relatively young. We're talking about 60s and 70s. And slowing aging, where we are actually able to delay the biological aging process itself. And that is the novelty, right? That would be the real sort of ideal case to be. And then they use these simulations to project the outcomes over time and estimate how much economic value each of these scenarios can potentially generate.
Okay, so let's break it down. The status quo, which is currently what we are doing right now, what happens if we just keep treating disease as they come when the symptoms appear, for example?
Yeah, well, that's what we are doing right now, right? So this is how we work. Our preventative medicine model, our reactive medicine model. We treat cancer, we treat heart disease and neurodegenerative disorders separately, but it's kind of a whack-a-mole kind of a problem. You cure one disease, but then another one pops up, right? And that's how the pharmaceutical industry has been structured in some ways.
Yeah, and that's the from an economic standpoint, this doesn't actually save us money. It just shifts the healthcare costs around, right? So it shifts from one disease to another. Oh, yeah, let's treat the symptoms for your heart disease, which is already generating some health burden economically, and then you sort of like kept it under control, but then something else appears, and it's just shifting funds around. It's not really saving any money as per
Yeah.
se, right? So
It's kind of like just coupling. It's kind of like just passing the buck around in a way, right? And you're just compounding. In some ways, you're compounding the interest, but you're compounding the interest on your health as well as on the money you're spending on your healthcare. So it's a pretty bad
mm,
model in my opinion.
yeah, it
Uh,
just makes things worse, right? It's just,
yeah,
yeah, it just really things makes worse because if you think about this, we already sort of extended our lifespan, so how many years we can live.
yeah.
But so we are living longer already, but what's the cost? Like, we're living in poor health. We actually not living. Like, I don't want to get into an age where I'm just saying that I'm alive, but I'm not able to do anything.
I'm like bedridden.
That for me is not that's
Yeah,
not
I'm like
living,
bedridden and vegetable, and I don't really do anything. That's not really helpful for me in some ways, right? Like I'm not able to sort of be functional, and I'm frail. That's not really helpful. Yeah, and well, then they had the second model, which is what happens if we increase lifespan but don't slow aging, right? Their second model, and this actually makes things a lot worse because now people are living longer but spending more years in poor health. The kind of, in some ways, the model that we have been moving towards these last few years, right? Which we were talking about, the extension of the difference between the lifespan and the health span, people spending more time in their chronic disease years. And this, of course, drives up healthcare costs, disability costs, social care costs, so on and so forth. Yeah, and that's
yeah.
terrible.
So I sort of feel like the first model and the second model are sort of like intertwined because you know in a way, we, as I said just before, we have extended the lifespan, and technically, we are seeing that it just became much more costly for healthcare funds, and we see this with increasing health insurance costs, increasing in the the burden of the need for hospitals and people being hospitalized. So it's just sort of like we are in those two, treating, reactive to the disease, but at the same time we already extended the lifespan in the past few years, and we just seeing that how much worse it becomes. So
Yeah.
it really shouldn't come as a surprise, but if you keep just thinking about extending the lifespan, how much more can we extend and how much worse? It's clear we already living it. So what is key here is the third model that they model, and what happens when we actually slow aging itself. Do you want to talk about it?
Yeah, that is where the things get really crazy. That's where numbers are really exciting. Now, their model predicts that slowing aging by just 1 year, and I'm repeating this, by just 1 year, add $38 trillion in economic value worldwide. That's $38 trillion. For reference, right? The total debt of the United States at this point is around $20 trillion. So we're talking twice the amount of US's debt added in just 1 year to the global economy. That is
Yeah.
mind-boggling.
Imagine that for 10 years. Imagine if you have, let's just keep the life span stagnant 120 years, but imagine if you could live now into your 100 healthy. Like, that's another, I don't know, 10 years, 20 years. How much money would that be? It's just
if you extend lifespan, like health span, by 10 years, you're essentially adding $367 trillion according to their economic model. For reference, greater than that's greater than the entire global economy right now. So imagine doubling up the global economy by just adding 10 years to everyone's healthy life. How amazing would that be?
That is I think it just kind of goes into my mind, what could we do with this money, how much more we could, I don't know, direct into having a like a healthier sort of like globe as well, and direct to environment or other things. So now we're not living just better, but we're actually getting to enjoy, because this is all being redirected to other things. It's just it's insane. But the question here goes into how can we do that? Can, it might sound like a science fiction, that how do we actually slow down aging? How do it's actually really isn't, there's a lot of things that are emerging and interventions that are showing promise. So yeah, tell me more about it.
Yeah, it does sound like science fiction at some level, right? Being able to add so much money to the economy and allow us to live longer, healthier lives. But that's what is so exciting about this field. There are a lot of different approaches, from cellular reprogramming to targeting molecular pathways involved in aging. We could be talking about small molecules, gene therapies, even AI-driven drug discovery platforms to identify compounds that slow aging. The opportunities are endless in this field, in my opinion.
Yeah, and the point here is that we're not just treating aging after it happens, but we're actually able to predict and prevent. So it's getting off that reactive sort of approach and going back into the personalized medicine, and really
Exactly.
tackling before it actually shows up. So we really getting rid of the disease before it actually gives us any symptoms.
Yeah.
It's just, yeah, it's great
Yeah.
in my opinion.
Imagine, yeah, imagine if we could integrate biomarkers, my personal favorite, and epigenetic data, another personal favorite of mine. I may or may not be biased, and multi-omic analysis to create a
We both.
personalized
We both.
both of us, to create a personalized aging profile instead of waiting for diseases to appear, right? We could track biological age in real time and intervene early. This is the kind of approach that could actually prove whether an intervention is extending health span and lifespan in individuals across the board.
Yeah, absolutely right. Because this is not the same for everyone. And this is what sort of like we have to come out of that mass approach where, we just average across the mean. It's some people age faster. Certain tissues will have different sort of like age rates, as I said in the beginning. So have some will have some genetic predisposition. So it's not a one size fits all approach, and that won't work. So the bigger picture is, we have to look into those personalized interventions and those biomarkers individual by individual. So, why does this matter now? Um,
Yeah.
do you want to talk about why is it so important that we do this now?
Yeah, and this kind of brings us back to kind of the ticking time bomb problem, right? Which is, if we don't change things now and how we approach aging, our healthcare system is gonna collapse. If I'll give you just an example, right? Like, at least in the context of US, the cost of sort of Medicare is about 4% of our GDP. By 2040, it's gonna go up to 6%. And it's only gonna go up as we go into the next few decades after that. And that's primarily driven by patient services, patient and physician services that are coming from sort of the elderly population. So, and if you don't essentially extend healthy working years and pension, then essentially what we're also going to see is a collapse of the pension systems, the social security systems that we are seeing, which will effectively become unsustainable. So there's a huge problem that we are facing in the upcoming years.
Yeah, absolutely. I agree. And it's not just in the US, it's in many, many countries. And that's why some experts argue that aging is bigger than treating climate change, for example, or even, geopolitical conflicts, because it's happening everywhere in every country. And we are not prepared for it. We're just not prepared for it.
Yeah. But at the same time, this also poses us a huge opportunity. right? Investing in aging research now could completely change the future economically, medically, and socially. And in some ways, right, that's exactly why we're doing this podcast to break down the science of aging and longevity and show why it matters to everyone.
Okay, so yeah, this is great. This is exactly the point. So it's not just the science people, the people that are actually in this field. So everybody can understand the pressing need of research such as what we're doing. So if there's one takeaway from today is that aging is basically the root cause of most chronic diseases, and slowing aging is the best investment that we can make for the future.
Yeah. And we hope this gave you a new perspective on why longevity research is so important, and not just for individuals, but for society as a whole.
Yeah, we would love to hear from you as well. So, what was your biggest question about aging? Make sure to interact with us as we go along in this journey with the podcast. We're going to be bringing more about the science as well. So, yeah,
Yeah.
great
And
first episode.
yeah, and make sure to follow us more on these deep dives into sort of the latest breakthrough in longevity science. And we'll see you next time on Decoding Longevity. Thank you so much for joining with us today. Bye bye.
Thank you. Bye.